Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
If I'm able to share my story with others in a way that can help them in a way that I didn't have when I was first diagnosed, I thought that would be just a great opportunity to pay it forward.
Welcome to the Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Steven Newmark, Director of Policy at the Global Healthy Living Foundation.
And I'm Zoe Rothblatt, Associate Director of Community Outreach at GHLF.
Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life.
Today we have an interview with Eddie Applegate. We talked about Eddie's psoriatic arthritis journey, advocating for yourself with your doctor, and also just how the chronic disease community helps support each other. It was a really great interview. I'm excited for you all to listen. First, we do have some news updates.
The HELP Copays Act was introduced this week in the House. The HELP Insure Lower Patient, or HELP Copays Act, to protect patients from harmful insurance and pharmacy benefit manager practices that raise out-of-pocket drug care costs.
And this is the federal legislation that helps fill in the gaps that people are left behind because the state doesn't cover everyone. Not every state has a law. And this is basically saying that if you use any money that you use towards a copay, whether it's a copay card or, a coupon, something from the manufacturer, any of those will count towards your deductible. So you can help meet your deductible faster and the insurance companies aren't double dipping. So this is huge. Because we know our community relies on regular medication.
Absolutely. This is legislation that we at GHLF have sought for many years, and I can't emphasize enough the bipartisan nature of this legislation. I know we hear a lot about dysfunction in Washington, particularly in Congress, but this is an area that has bipartisan support, and with that support, we're hopeful it'll get pushed through. We hope it gets pushed into law.
And similar to the discussions we've had with the Safe Step Act, this is something that's been introduced in years past, which always is more hopeful as we gain more co-sponsors on the act. And finally, shout out to our colleague, JP Summers, Patient Advocate Community Outreach Manager here at GHLF.
Yes.
She advocated and spoke at a Wisconsin press conference on the importance of this bill and how it helps patients. So thank you, JP, for all your work with the 50-state network.
Absolutely. Great job by JP.
Our next news update is a little bit of research news. So we have some answers on protection from a previous COVID infection. This new study, it was a meta-analysis, which means they analyzed 65 studies from 19 different countries. It was published in the Lancet. And what they found was that risk of hospitalization from COVID among people who were previously affected is 89 to 90% lower for at least 10 months post-infection.
Yeah, excellent news for pretty much everyone. It's great news if you have been infected, of course, but it's also good news if you've not been infected because it means that there are folks walking around who have been infected who have greater protections for themselves, which will inure to greater protections for the community as a whole.
Exactly. And the study did find that protection from past infection from the earlier variants was high, but it was substantially lower for the Omicron BA1 lineage. And, obviously the study authors recommend that vaccination is still really important and the safest way to get protection, especially because vaccines also are important for, older adults in our community with underlying illness who really rely for those around them to have protection. And, a vaccine is guaranteed protection versus an infection. We really don't know so much.
We also want to mention this is our last recording in the month of February. And as we end Heart Health Month, there's a few tips that we wanted to share for you and your loved ones.
Let's hear it. It's really interesting how much heart health overlaps with chronic illness, like inflammatory arthritis, things like that. There's such an overlap among co-conditions. It's hard to remember to consider it all. So what are the tips, Steven?
Well, some tips are, as with anything else, always start with a good team. Start with your primary care doctor and add a cardiologist to the mix when it's appropriate to talk about your heart health. When you have your team assembled, make sure that you get proper heart tests to get an accurate picture of your cardiovascular health. Obviously, it's important to make healthy food choices. The Mediterranean diet has been found to lower the risk of heart attack, stroke, and heart failure. And stay active, get moving. Exercise can improve vascular function and reduce the risk of cardiovascular disease.
Great. I mean, it's more of the same stuff that we hear for other chronic diseases, which is good news because I might already be doing some
Right.
of it, but just adding a little bit more on shouldn't be too much
Yeah.
of a burden. So, like I mentioned, I spoke with Eddie Applegate. We had a really great conversation about ways to just speak up for yourself along your journey. Whether it's the beginning of your journey or you've been living with a condition for a while, it's always important to connect with others and get these tips. So, yeah, let's have a listen to Eddie. Good morning, Eddie, and welcome to the Health Advocates. It's so great to have you here today.
Good to be here this morning, Zoe.
So, why don't you begin by introducing yourself? Tell our listeners a little bit about you, your diagnosis, and where you're at today.
My name is Eddie Applegate. I am originally from the great state of Alabama, but I've been living in the Atlanta, Georgia area for the past 10 years. I work with making sure commercials run correctly, so I'm sorry, I guess, since I'm the one I'm responsible for some commercials and some programs. So, like I said, my apologies on that one. I was diagnosed with psoriatic arthritis it's been about 20 years now since I was first diagnosed. And I like to say that my diagnosis story is much different than other people's because I was actually diagnosed early the first time and by an urgent care doctor, which whenever I tell people that, they're like, "You're kidding." I was like, "No."
Yeah, my jaw dropped when I found that out.
I hate that it is such an anomaly in the lore of diagnoses, but I had been having issues with pain and with stiffness. Getting in and out of a car was tough and painful. And so I finally asked my mother at one point in time, "Do you think that I have arthritis?" And she said, "I don't know, you may, but you would need to get a referral first." So that's why I went to an urgent care just to get a referral to a rheumatologist. But I think I had the one urgent care doctor who had heard of psoriatic arthritis. I had never even heard of psoriatic arthritis, but with the symptoms on my chart, and then he looked at me and he looked at my fingernails, which had some pitting in them, and he looked at my skin, which had psoriasis on them. He said, "I know exactly what you have. You have psoriatic arthritis." And I was able to get a referral to a rheumatologist very quickly because it was a new rheumatologist at the practice. So I didn't even have to wait a long time like
Wow.
others do to see the
Right.
rheumatologist. I think within a month I was seeing a rheumatologist, and that led on my journey of 20 plus years. Right now I am at a period of lower disease activity. So I'm very thankful for that. Thanks to good medications. I'm very happy with that. That's my story in a quick little nutshell.
Oh, I'm so glad to hear that you're living with low disease activity today. That is such a win. I wanted to ask, you got a quick diagnosis. What happened next? When did you start, advocating and sharing your story and being open about your psoriatic arthritis?
That was a little further down the road. I'd tried some medications that didn't work. I'd even gone off of medication at some point in time because my insurance had changed or I'd lost insurance. It's amazing how having the right job and the right insurance affects our healthcare. That's another story for another day, but
Yeah.
that's it's very important. But I'd finally been in a good place medically, and I saw something with the Arthritis Foundation actually, like, oh, the yearly walk. I was like, well, you know what? Several years ago, I would not been able to do this walk, so why not? Why not try it? And so I did a little fundraising for that, and after a few times, somebody that worked there said, "I keep noticing your name. It's great to meet you. If I ever have anything, I'll let you know." And that led to being a part of an ACR symposium one day on psoriatic arthritis from as the patient. There were a lot of clinicians, and then they had some patients sprinkled in there as well to get the patient point of view. And that really is what started it. And then I met Ben Noel from from GHLF, and he's like, "Hey, we've got something called patient governors, and we're still looking for some. And think that you would be good. So if you'd like to do that, sure, why not?" I thought things are being put in my path for a reason. These opportunities are being put in my path for a reason. Why not get a chance to speak as a patient from my point of view? Because a doctor can speak 24/7, but it's different when someone who actually has the disease tells their experience. that's much more that hits much closer to home. Because when I started with psoriatic arthritis, 2003, there wasn't a whole lot on the internet about psoriatic arthritis. There wasn't social media like there is now 20 years ago, which makes me feel way older than it should, but it was that way. There really wasn't anything to. There may have been some message boards or some people commenting on things, but there's not what we have now. So if I'm able to share my story with others in a way that can help them in a way that I didn't have when I was first diagnosed, I thought that that would be just a great opportunity to pay it forward.
I love that. I totally agree. It makes such a difference to hear things from other patients. As I think you know, I live with spondyloarthritis and Crohn's disease, and just opening up about my disease, I've had a similar experience to you where you meet people along the way that help you, and you in turn can say something that helps someone else recognize symptoms. And it makes such a difference having that in between the doctor's visits. Like you mentioned, you go to the doctor, but what happens in between? And you have this sense of community advocating with you in between, which is amazing.
Absolutely. And I have made wonderful friends through my arthritis journey that I talk with, most every day about arthritis things and about non-arthritis things. But it's good to have somebody because not everyone understands like, oh, well, the doctor told me this, or my medications make me feel like this. The average person is not going to know what that means. So it's good to have somebody that does know what it means. And also I found out a few friends of mine that whenever I would post about stuff, they've messaged me privately and said, "Thank you for speaking about this. I have psoriatic arthritis. I don't feel comfortable speaking like you do, but I'm glad that you are speaking out and telling your story. It does mean a lot." I was like, "Wow, thank you."
I think that's so key. Everyone advocates in their own way. And even just like the person that doesn't want to share but is reading your story, that also is a form of advocacy because they're getting the knowledge and really trying to take control of their care. So that's amazing. Eddie, you joined the Psoriatic Arthritis Club, another podcast under our umbrella. And I really wanted to bring you on here to do a little crossover and talk about some of the things you mentioned on there. I was listening to your episode and you said, because if you don't say something, then nothing's going to change. If a change is needed, if you feel a change is needed and you don't say anything, the doctor is not going to know. That was a really powerful quote to me and just like really highlighted to me how much you've advocated for yourself on your journey, even with a quick diagnosis. It still may be a long road living with a chronic disease. Can you talk to us about a time you remember speaking up and a change that you felt you needed?
Absolutely. I think that the medication that I'm on now is because I had advocated for myself. You can't be shy whenever you go to the doctor's office and go, "Oh no, I'm fine. I'm okay," if you're actually in pain. Because if you say, "Oh no, I'm fine. I'm not in pain," that's what the doctor's going to believe. And if you are in pain but you say you're not in pain, the doctor is not, I think I've said before to people like, "Well, the doctor's not a mind reader." You have to tell the doctor exactly, or the nurse practitioner or the physician's assistant, whoever the medical professional is that you're seeing, you have to tell them if something is wrong. I know that I kept mentioning to my rheumatologist, like, yeah, I'm having some issues in my ankle and my knee. He said, well, maybe it's time for a medication change. He was always great to listen to me. If I was having some issues, there would be times when he would bring out his little ultrasound machine and, run it over my hand, run it over my knee just to make sure, go in there and look and see. But if you don't say anything, nothing changes. That goes for any situation
Right.
in life, not just on a medical situation, but any situation in life. If you don't say anything, nothing's going to change because people are going to think that everything is good the way that it is. So you have to say something. If you feel that the medication isn't working, if you have a new symptom, if there are some side effects to the medication, you really need to say something, or else you're going to stay where you are because the doctor will think, okay, where you are is fine. So it's important that you do speak up so that they know. You don't want them to say, oh, well, you never said that you were feeling bad. Oh, you never said that this was an issue. Say it, put it out there. And if they don't listen, make them listen, but at least you know that you've said something.
So, what advice do you have for others that are maybe a little bit timid to speak up? How can someone get to the place that, you've got to where you are recognizing symptoms and saying it out loud?
I think that if you are a little timid and a little hesitant to Some people may think, oh, well, I don't want to contradict what the doctor is saying. I don't want to, seem like a bother. If saying something is a problem, write it down. I'm a big advocate of, if you know that there's some issues going in, write down those issues before you get there, even if you just want to hand it to the nurse practitioner, to the PA, to the doctor. It may be easier than just saying it out loud. This is how I'm feeling today. On the chart, I know that every time I go, I always have to mark on the chart how I'm feeling. Be honest on there. So if you don't want to say anything, at least be honest on the chart. That is super helpful because they're looking at that over time. Maybe like, oh, you were a 4 yesterday. You were a 4, 3 months ago or 6 months ago, but you're a 6 today. All right, what's going on that we have this change? So honesty is the number one thing, whether that's honesty in speech or honesty in writing it down. If that makes you feel a little less aggressive or whatever, but just write it down if saying is too much.
I think that's great advice, especially because sometimes when you get to the appointment, you go blank and forget what you want to say. So just having it there as that little reminder and push to say it is really helpful.
Absolutely.
Well, Eddie, thank you so much for joining us today. I really appreciate your time and you sharing your story. You mentioned 20 plus years. I feel like we're just getting started still. Thank you.
You are very welcome. I'm very glad to be here, and I'm having to keep all this advice fresh in my mind because I just switched rheumatologists because my rheumatologist of 10 years just left his practice, and
Oh,
so
wow.
I've started with a new doctor as of this week, and so I had to remember that for myself. So when I knew that this was coming, I was like, well, this is a good way to put my own words into practice, and hopefully I'm listening to myself and and following my own advice so that I can speak up. And that's what I did. I said, this is how I'm feeling. And I think that he could tell that I had a good knowledge of what was going on. So I was able to be involved in my own treatment plan. And I think that really impressed him. But that's another reason to speak up, because you want to be informed, you want to know what they're doing. You are the most vital and integral part of your own treatment plan. So being informed and speaking up is very important because of that.
Well, before we go, I actually have one more question. You just mentioned you switched rheumatologists, and I've been hearing a lot about that in our community, people's rheumatologists retiring or, there's not one in their area. How did you go about finding a new one?
Well, this one I didn't have much of a choice with because my doctor sold his practice to another group, and they said, "Okay, yes, you can still come to this location. There'll be doctors from that practice that are here a few times a week, and so you'll see them." So at least I didn't have to go out and search. But once I found out who it was with, you better believe I went to to that practice's website. Let's find this doctor. Let's see what his credentials are. Let's see what he is doing. But the important thing is research. Unfortunately, the first research has to be, do they take my insurance? That's
Right.
the
I was
that's the
about to
first
say
thing.
you're running to your insurance,
You are
figuring
running into
out,
your insurance
please.
website. I have done that on other specialists. Like, okay, go to my insurance website. All right, so what specialists are covered? Okay, so now who's closest to me in the Atlanta area? It's a very big area, and so just because somebody's in the Atlanta area, they can still be an hour plus away from me. So I'm like, okay, so let's insurance and then closeness, and then all right, let's see what the websites look like, and do they have a lot about the doctors and their credentials and things like that. But I've done that with other specialists. I've kind of gone through that research. I think I've done more research on doctors sometimes than I have on buying a car because that's a little more important. Like, a car is going to get you where you need to go, but a doctor is going to be the one that, makes sure that you are able to function. So, well, doctor's a little more important. But like I said, with this one, it was like, okay, this practice is taking over, and then I was kind of like assigned a doctor. I didn't even get the doctor's name till like a week or so ago. So it was,
Oh, wow.
to me, they're auditioning for me, not the other way around. It's like, do I want to stay with them? Do I trust them enough? That's how I always look at it. It's not, am I good enough to see this doctor? It's like, is this doctor good enough to see me?
Yes, I love how you just framed that. It's under the same umbrella as this medication failed me. I think we need to do so
Exactly.
much in flipping the script on what
Absolutely.
happens in our care. And And we are, we're the person, it's our life. It's up to us to have a say and
Yeah,
be the main person.
and feel comfortable with the doctor. And so I think that is important. We're not auditioning for the doctor. The doctor's auditioning for us. We want to make sure that we have that comfort level, and that they have the knowledge base that we require of a clinician. So, and if they don't, we search again. And I know that unfortunately, especially with rheumatologists, it is tough to find multiple rheumatologists in an area. And so some people are kind of stuck with who they have just because of the lack of rheumatologists in the area. If you can and have to, find the one that's right for you.
Well, on that note, thank you, Eddie, for joining us today and sharing your insights and advice from your journey. I know it's going to help so many people. So thank you.
You are very welcome.
Wow, that was really great hearing from Eddie. What a fascinating journey that he's had with psoriatic arthritis. I'll preempt your question, Zoe, by saying I really learned a lot about, advocating for yourself with your doctor, and just hearing from patients like Eddie is so valuable to the community at large.
I totally agree. Listening to Eddie was so important, just about his tips about, don't be shy. The doctor's there to help you. Speak up is really helpful reminders.
Well, we hope that you learned something too. And before we go, we want to give a shout out to Healthcare Matters, fantastic program run by our colleagues Connor and Robert. And they've done many deep dives on important issues, and you can check it out along with all of our podcasts at ghlf.org/listen.
Well, everyone, thank you for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you like this episode, please give us a rating and write a review on Apple Podcasts, hit that subscribe button, and check us out on YouTube. I'm Zoe Rothblatt.
I'm Steven Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.